Hi, Dr. Windisch again from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents. Remember that these videos are not intended to replace visits to your physician. So if you're having concerns or questions, we're happy to see you here in our office. Give us a call at 775-359-7111. Today what we want to talk about is something that's actually very ominous and a very serious problem for our society at large, and that is the consequences of the childhood obesity epidemic. When I was a child, there was the overweight child in the neighborhood, and he's still a good friend of mine. He shall remain nameless, but everybody knew who he was. Now, typically there is the skinny child in the classroom, and everybody else in the classroom tends to be on the heavier side of normal, if not overweight. For my school-aged children, 9 out of 10 of them who are brought in to me because the parents are concerned that they're not growing well, they're actually normal. And that problem is because of the parents' perception. When they look at Johnny lined up with his and her classmates, they realize he's the skinniest kid in the class by far, and they're worried about him. But what they don't realize is he's the normal one. It's everybody else who has the problem. There are estimates now that as many as 1 in 3 children is morbidly obese. That has tremendous consequences for the health of the children, so we want to examine some of that. Number 1, obesity results in diabetes. This is adult type 2 diabetes. If the children develop obesity-related diabetes before their 16th birthday, they die on average 20 years younger than if they're non-diabetic. Putting that in terms of ages, the average life expectancy in the United States is 78 years of age. That means dying at 58 years of age. That's young. Cause of death is usually heart attack, renal failure, or stroke. And usually, that is not your first heart attack, that's your 3rd or 4th heart attack that gets you. Okay? That means having your first heart attack when you're in your 40s, my age. That's very concerning. Kidney failure, if you develop it, requires dialysis, and for anybody who knows anybody on dialysis, it's a miserable way to live. It is, however, preventable. If we keep the weight down, we keep the blood sugars normal. If the blood sugars are normal, diabetic nephropathy flat out won't happen. If you're not a diabetic, you won't get diabetic nephropathy, and that is the #1 cause of renal failure in this country. Number 2, being overweight causes high blood pressure. I have a number of children in my practice, unfortunately, who have to be on blood pressure medications. It's not good for them, but it's better than letting them walk around with the high blood pressure. High blood pressure causes damage to the brains, damage to the kidneys, damage to the heart, on top of the damage being done by the blood sugars. It's a 1-2 punch to those organs and speeds up their rate of failure by quite a bit. It's bad enough walking around with high blood pressure when you're in your 60s, and we aggressively manage that so as to maintain the health of our elderly patients. Walking around with that for 30 years is an unimaginable problem. And we quite frankly don't know how bad it is. We know when you're 60, walking around with it will shorten your life by quite a bit. How much will it shorten your life when you're 20 walking around with that? Couldn't begin to guess, but we know it's going to be horrific. Finally, and probably most mortifying to me, is something called nonalcoholic steatohepatitis. And I see this way too commonly. The patients put on fat so quickly their liver doesn't know what to do with it, so it deposits the fat inside the liver, resulting in what we call nonalcoholic steatohepatitis, or NASH. This is essentially human foie gras. And if you're familiar with how they make foie gras, you'll realize that, or how they generate foie gras in geese, you'll realize that a number of cities have actually banned the sale of foie gras as animal abuse, because the production is considered to be cruelty to animals. This fat, as it's deposited in the liver, slowly destroys the liver. Given enough time, the patient will die like an alcoholic, only they weren't consuming alcohol. When patients die of alcoholic liver failure, they're bleeding out of every orifice, their belly is bloated, they're yellow, they don't know where they are anymore, they're confused. It is a horrible way to die. And it is preventable. We prevent it by keeping the weight down, and if you keep the weight down and keep your weight normal, the non-alcoholic steatohepatitis will reverse itself. However, if you've had NASH for any length of time, you do start getting scarring. The scarring is permanent. The good news is you can probably live with a certain amount of scarring in your liver as long as you don't allow it to progress. If you allow it to progress, there's nothing we can do. This is quickly becoming a major reason that children need liver transplants nationally. And liver transplant requires lifelong medication. Liver transplant requires lifelong attention to your diet, to your health, and shortens your health by quite a bit. It's better than dying in liver failure, but it is still a very unpleasant way to have to live. It can be avoided 100% of the time in cases of NASH. There are other diseases that cause children to have liver failure where it can't be prevented, and those cases are flat out tragic. But the cases of NASH don't have to happen. As a parent, you have complete control over this, and I'll refer you back to our video on recommendations for obesity and for childhood overweight. But these complications are not rare. I see children with NASH every day in my office. I see children with hypertension every day in my office. And I see children with childhood type 2 diabetes every day in my office. All of these children in their 40s and 50s will be dealing with the complication of their obesity because we did not control their weight now. There's no magic cure for the weight. As a parent, you hold the key to your child's long-term health and success. I hope you're able to grasp that golden ring for your child. This is Dr. Kevin Windisch. I hope this has been educational for you. Again, we can be reached at 359-7111. We'll see you next time.